It is that time of year when viruses like the common cold, COVID, and the flu spread around. These illnesses can be serious for pregnant women, older adults, or anyone with a suppressed immune system. So tonight we're talking with a physician about what you can do to protect yourself or how you can manage your symptoms if you are indeed sick. And joining me now live in studio is infectious disease specialist Dr. Thomas Russo. Thank you so much for joining us on the 5:30. It's been a long time since we've seen each other.
Yes, it has.
A lot of people, as you know, and you're probably getting the calls, are sick right now, and they're having a lot of symptoms that seem to be sticking around for a long time. Is that normal? Is there a reason why we're seeing this, and what can be done?
There is a reason. It's winter respiratory virus season. And though RSV is on the wane, though there's still some out there, we've got an increasing number of cases of influenza and COVID, and that's really what's primarily driving these individuals that we see that are sick right now.
There is a concept going around talking about immunity debt. Maybe that's something you can explain. What is that? Some experts say more people have a decreased immunity now because not as many people were exposed to the flu or RSV. Can you talk about that?
What an immunity debt is that our protection that we have against a given infectious agent, it wanes over time. So if you don't see it for a prolonged period of time, you'll be more susceptible. And what's going on in part right now, primarily with COVID, is even though we built up a lot of immunity from prior vaccination and infections, that has waned. And you package that together with the virus that continues to evolve, we have an increasing number of individuals that are susceptible. Plus, let's throw in the fact with the religious holidays, New Year's, travel, we've been getting together, perfect circumstances for this virus to spread.
I think you're right about that because I can probably count on both hands, maybe more if I have more hands, of the number of people who are sick. And can you talk a little bit about people who are having head colds, COVID, but then that cough that's lingering, that's out there too?
Yeah, it's not uncommon after an infection with a respiratory virus to have a cough that could persist sometimes for weeks. And that's because we get a little bit of mechanical damage to our airways and they're irritated. That stimulates that cough, and until those airways get back to normal, that cough can persist.
And you're probably seeing that too. A lot of people are coughing right about now. Once again, I think for most people who are watching, they want to know, what should I do? What should I not do? And will this wane?
This eventually will wane. However, right now there's a number of measures that we can do to protect ourselves. The good news is we have the tools to minimize the consequences of these potentially lethal respiratory viruses, namely influenza and COVID. Vaccination is the first and our most preventative tool. The uptake has really been less than excellent this year. Only 20% of people have gotten that new formulation. And it's important to get that with that immunity debt, as you mentioned, as our immunity wanes and the virus continues to evolve. And of course, appropriate mask use, hand hygiene. And if you do develop symptoms, please stay home and test, because if you test positive for COVID, or if you test positive for influenza at the healthcare facility, we have some drugs that could minimize the consequences of that infection.
Excellent advice. People need to hear it because this is real life and what we're dealing with right now. Dr. Thomas Russo speaking with us here on the 5:30. We want to thank you so much for joining us, for that insight. I'm sure we'll be seeing you before the winter is over.
Well, thanks for having me, Claudine.